First, does anybody have any questions for Dr. Shenoy?
Yeah, so just on that note, with Save Kids organizations, why just Save Kids and not, have you looked at other organizations like Injury Free, coalitions, et cetera?
Not at this time, but we'd be happy to look at that. It's basically areas within certain jurisdictions. For instance, Austin, I know Safe Kids and the other organizations can work together. So it's a something in process. I think it's a great idea to get.
You can add additional.
Oh yes.
Just to put that out.
Yeah.
Any other questions for Dr. Shenoy? Any questions from the audience for Dr. Shenoy? Okay, Sam.
All right, so the Pediatric Emergency Care Council of the National Association of State EMS Officials, CMSO, from our spring meeting last month, we are investigating and initiating an evidence-based nationwide injury prevention program that will be specific for EMS, geared towards pediatrics. Like I said, we are just starting that, so I don't know what that will look like just yet.
Is this a course or a training or?
I'm not sure. It will be an injury prevention initiative.
Okay.
That will be specific towards EMS agencies, that whether that is fall prevention or motor vehicle crashes or drowning or whatnot, we're not sure yet. All the states are trying to get together as far as what are their top issues right now, whether that's falls, motor vehicle crashes, whatnot, and then we'll try and address some type of injury prevention program towards that. Then NASEMSO has joined with the National Strategy on Highway Safety and has developed a program called Towards Zero Deaths. It's a vision of eliminating fatalities on the nation's road. So it's the National Strategy on Highway Safety Towards Zero Deaths effort was created by a steering committee cooperative that includes organizations that represent the nation's highway safety system and have joined together to reduce annual traffic fatalities from more than 33,000 a year to zero. So the steering committee, which includes NASEMSO as one of 8 organizational members, rolled out the Towards Zero Deaths plan that provides engineering, enforcement, education, and EMS organizations with initiatives or safety countermeasures that can be enacted by public agencies, businesses, and individuals. And there's more information on that on the NASEMSO website, which is nasemso.org.
Hang on just a second, Sam.
Could you say SIMSO? What I'm taking notes.
NASEMSO, which is .org.
One more time.
Sorry. NASEMSO.
Thank you.
.org, yes.
Got it.
So then, many of you are probably familiar with, several years ago, NHTSA, the National Highway Traffic Safety Administration, produced a document entitled The Safe Transport of Children in Ambulances. And within that document, they recommended things such as car seats and other equipment, and more companies are building more and more equipment that attach to stretchers, and you are starting to see a lot of them at the EMS conferences and other trade shows. The problem is none of those devices, including car seats, have ever been crash tested in an ambulance. So the Pediatric Emergency Care Council of NASEMSO passed a resolution, and well, the board of NASEMSO passed a resolution a few months back that will encourage NHTSA to take a fresh look at this document and use their influence to actually crash test these devices to see if they actually work or not, to prevent morbidity, mortality in kids in the event of an accident in an ambulance. That has met some resistance in the past, but there is a new director of NHTSA whose wife is apparently a pediatric nurse. So there is some opportunities there, and I know NASEMSO is, along with some of their other national partners, are starting to push this initiative. Then, if you all watched the Super Bowl, you know that Nationwide Insurance Company aired a commercial that created a lot of controversy. However, it also brought a lot of awareness to childhood injuries and injury prevention. So the Pediatric Emergency Care Council of NSEMSO, as well as the Medical Directors and Trauma Committee of NSEMSO and the Board of Directors, sent a letter of support to Nationwide, telling them good job, basically. Then, speaking of Safe Kids Worldwide, in December, Safe Kids Worldwide held a global summit on safe roads in Washington, D.C. And the major focus was to launch the campaign Safe Roads, Safe Kids to improve road safety for children worldwide. It was a call to world leaders to have a goal of cutting in half road traffic fatalities in 2015 so that kids worldwide can be kept safe. Because as it is right now, more than 500 children worldwide lose their life to a traffic crash daily. And with thousands more injured every day from traffic crashes. So that is a Safe Kids Worldwide initiative. And that's all I have for you.
Okay. Stuart, did you have a question for Sam? Any questions for Sam? Any questions from the audience on National EMSC activities? Okay, thank you, Sam.
Thank you.
Okay, next thing on the agenda is just what we could discuss and just provide an update on the status of injury prevention related legislation for the 2015 legislative session. And Courtney has passed me her TTAP update that Donna has provided. So I thought we would just read through this quickly. In the meantime, can somebody look up the Narcan, where we are on that bill, either Courtney or Stuart. The Injury Prevention Committee has been following several bills, safety-related bills that have been brought forth to this 84th legislature. One of them is House Bill 80, which is related to texting and driving. My understanding that bill passed overwhelmingly in the House. And the Senate committee is actually here, or the Senate is actually hearing it today. Is that correct? I think somebody said it was being heard on the floor today. I think we are hopeful that this bill will pass. It still remains to be seen. I don't know that we've heard whether or not the governor will sign it or veto it. So that's where we are on the texting and driving bill. There are several bills related to trying to eliminate red light cameras in Texas. I know that Stuart has testified. Courtney has been providing information. Marianne sent a letter, an op-ed letter to the editor. I wrote a blog piece on it. Unfortunately, those bills look like that they are likely to, or the red light camera bills, it looks like that they are likely to be eliminated. It is, I know one piece of the House, and I'm trying to think of which one it was, one piece of the legislature actually voted to eliminate it. It then went to the other, and I think it's being held up in committee at this point. And I'm not familiar, I don't know if anyone else is or anyone in the audience knows any more of an update on the status of the red light camera bills. We heard today in TTAP that there's been discussions about holding those funds and whether those funds will be dispersed in the manner in which they were intended and things like that. But it looks like Texas wants to repeal and eliminate red light cameras. Not only would these bills eliminate any future red light cameras, but they would eliminate all existing red light cameras as well. So I don't know if anybody else has anything more to add on that. And then there was a lot of discussion earlier regarding the driver responsibility bill. I know that several people, including Jory Klein, was in town to testify, and I understand it got pretty heated in terms of the driver responsibility committee and things like that. From what I heard at the TTAF meeting this morning, Lori did an excellent job of defending and talking about the lives saved that the driver responsibility bill could do. But at this point, I don't know if it is still in jeopardy of being eliminated. And Courtney, I don't know if you have anything on that.
Something to
Okay.
watch.
Yes, there's still, the budget is a lot of the budget bills are still being decided, and so that's where TTAF is spending a lot of their time, and that's looking at not only trying to get funding for the trauma hospitals, but actually getting the funding dispersed to the hospitals in need. And then the final bill was that we were sort of watching was a bill, and I don't remember the bill number, but it's basically an anti-poisoning bill, but it would be able to, anybody would be able to provide Narcan to somebody who is having, suffering through an overdose or something like that. And several states have passed similar bills. In the states that have passed bills like this, they've actually been able to, within the first year, markedly reduce the number of people who die from unintentional drug overdoses. I know it passed, whether it was started in the Senate or started in the House, it passed and was moving forward. And so, Courtney, have you found an update on it?
Senate Bill 1462. Okay. It passed the Senate and it's was referred to the House from the Senate. It's been read the first time and is currently in the Public Health Committee of the House.
So those are the bills that that this committee is kind of been tracking, monitoring, following. Committee members, do you have any other updates or any updates from the audience? I don't know if Brenda's in here, if she has more of an update. I think I looked at, Courtney, do you have anything to add or?
I just walked in, so I missed what you've already covered.
We talked about texting and driving, we talked about the Narcan bill, we talked about red light cameras and driver responsibility.
I think those are most of the
Okay,
things.
thank you.
Is the Narcan bill on set to be potentially read before Thursday in the House? Or is it one of those that's probably not going to get a second reading? Not put you on the spot. Actually, I guess I on purpose put you on the spot.
I just scrolled through, it's like 13 pages.
Yeah, so if it doesn't get read by Thursday, Dinah updated today that it would not, that
Okay.
it would be that they're killed at that point.
Okay, thank you for that. Next thing on the agenda is discussion about the implementation and evaluation of the hospital-based injury prevention components. Just a brief update. This is something that this committee, along with representatives from RACT, TTCF, TTAF, and others worked on last year. It establishes suggested core components for hospital-based injury programs. There are 5 of them. The first one is using data to determine, prioritize your injury prevention priorities, also using data for evaluation. The second one is working in collaboration with other stakeholders and partners in the community. Third one is providing appropriate injury prevention training for the trauma or the injury prevention coordinator, trauma coordinator, and then continuing education for that person. The fourth one is implementing evidence-based strategies, and the fifth one is evaluating the strategies that you implement, but also looking at overall program, hospital-based injury program evaluation. So that document is available on the GTAC website under the Injury Prevention Committee materials. We are also working on an evaluation to evaluate the changes in reported hospital injury prevention programming as a result of this document. We will be, we're actually, we have devised a, 10, 15 question survey that will be distributed to several racks. We'd like to distribute it statewide, but we're distributing it heavily among certain racks. One is the San Antonio rack, one is the Dallas-Fort Worth rack, one is the Austin rack, one's the Temple rack, and I think the Houston rack was the other one, where we were going to implement the survey. That will probably be coming in August or so. Go ahead, you want to talk?
So my office kind of took on the responsibility of putting together the tool and the paragraph talking about this QIPI project, and that's being submitted in this week or next week through the IRB process to basically get an exemption. It's not human subjects research, it's basically a QIPI project, so we shouldn't see any issues with it moving forward.
Okay. So the plan is that will be distributed in those racks possibly during August. We're also talking about doing it pen and paper. We're talking about doing it electronically. We want to get several responses, and then trying to do it yearly for the next several years, just to see if we can track and monitor reported changes in hospital-based program activities and things like that. This is a project that's gotten a lot of national attention. Stuart actually presented on it a couple of weeks ago at the Safe States Alliance annual meeting, and you presented on it in 2014 as well. We will be presenting on it, several of us will be presenting on it at a regional injury network meeting in Dallas at the end of this month. It's starting to get not only attention from our region, but also other national partners, including the American Trauma Society, EAST, ESTN, some of those acronyms that are interested in what we're doing in Texas, and particularly interested in elevating it to a national level. So we'll continue to keep you posted on that. But for those of you who are in the racks that I mentioned earlier, be looking for the survey. If you haven't already looked at it, and we encourage everyone, but particularly people in the racks that I mentioned, to go online and look at the document. There was some discussion about it being a long document at our Houston meeting, and we kind of chuckled because it's 36 pages, and I think there's part of that is including references
And double-spaced.
and double-spaced. So if nothing else, skim it, particularly look at the 5 components, because the survey will ask questions about what you think of the components, how you're utilizing them, whether you think it's necessary, and some things like that. So I encourage you, if you haven't already looked at the document, please go online and do that. If you can't find it online, email me and I will send you a PDF version, or anybody on the committee can send you a PDF version of that. Committee members, do you have anything to add to that?
It's a great document, y'all. It's very good.
Just from our workday meeting last month, the suggestion was made that we break the document into its respective chapters individually, so that each chapter is available online. And so if you don't want to read the entire document, if one of the sections is interest of you, you can at least just go to that one section individually. So that would just be helpful.
Susan?
I'd just like to add that it is a living document. It's something that we have put together at this stage, but are encouraging everyone to have input so that we can make changes, improvements as we grow it. It is a document that is set aside or set out for any level trauma center. We took great pride in saying that this could be for the basic level 4s up through the level 1s, so that we tried to address all of the issues that concern everyone in trauma injury prevention across all of those areas.
Thanks, Susan. And Stuart just mentioned it's actually not targeted just to trauma hospitals, so it's any hospital that can do that. Are there any questions about the document? Because I was going to follow up with some of the discussion that we had at our workday meeting in Houston a few weeks ago, which dovetails into the document. But I want to give anybody in the audience, if you have a question about the document. Okay. Well, one of the things that we did in Houston is one of the core components is to implement evidence-based strategies. And this committee has had lots of discussion about this. And over the course of the last year to several months, we feel like that a lot of times we will just, the term evidence-based or evidence-informed just rolls off our tongues, and we expect everybody to know exactly what we're talking about. And the reality is, I think what we're finding is that it's not everyone knows what truly is evidence-based. It's described in the document, but I've seen Courtney and Stuart give presentations where they talk about, you know, using evidence-informed or evidence-based strategies, and then somebody in the audience will raise their hand and say, well, here's another evidence-informed strategy, and it's clearly one that hasn't gone through the rigorous evaluation that a true evidence-informed strategy has. So one of the things that our committee has decided, the project that we're going to do this year is to add supplemental materials. As Susan mentioned, this is a living, breathing document, but to add supplemental materials to the document. And one of the first things that we're going to do is develop very quick and easy to read fact sheets on evidence-based programs. So one of the things in the documents that says, you know, if you're interested in finding where the evidence is, go and look at the Community Guide for Community Preventive Services, or go and look at the Cochrane Review, or something like that. And I will have to say, I've been doing injury prevention for a long time. I spend a lot of time online looking at the scientific literature, and often it's very scientific. It's not a quick and easy document to read, and so you have to really be able to not only look at the literature and determine the validity of the studies that they've done. You have to sometimes interpret those studies, and I don't know about you guys, but sometimes I don't have time to do that. So I think what we decided to do as a committee is put that into an easy to read document. Someone on my staff at the Injury Prevention Center of Greater Dallas started it, but unfortunately didn't get it all finished. So we've decided to take this on as a committee. I have examples of here of what it's going to look like. The one thing that we have done already is the alcohol and injury document. And so it's basically, and I've got copies in front of all the committee members. It breaks it down into the things that you will see in green are the things that are evidence-based. They're strategies that have been proven already, and the longer version, this one happens to be about 5 pages, will actually include the references too, but it's broken down into much easier to understand language. In yellow, as in yield, are the things that appear that haven't been proven yet. It doesn't mean that they're detrimental, it's just that they need more evaluation. So that will be listed as unproven but need more evaluation. And then the things in red, if there are things that are detrimental, those will show up here. These are things that have been proven to be not only to not work, but to be detrimental overall. So we're going to have a document like this, and each of the committee members at our Houston that were at the Houston meeting took on certain topics. So we're gonna try and do a few topics a year. So we will have a document like this that is going to be just a little bit longer, and then we're going to have just a quick flashcard that says green, yellow, red. Do this. If you do the yellow, if you do this, be sure to build in evaluation, and don't do the red, which is the stop sign. The topics that I think we have decided on are, I think drowning is one of them, child abuse is one, older adult falls is one, domestic violence is one.
Concussion.
Yes, can you guys, suicide? Concussion is one. And what?
Youth-based violence.
Youth-based violence. So those are the ones that we're doing first. We're doing those first because we had committee members that were well versed in those subjects, were interested in those subjects. It doesn't necessarily mean they're the top causes of injury, death in Texas. Those are just the ones that we've decided to do first. We hope to have a first draft of of the ones that we're doing first by our July workday meeting, which will be in Austin late July. And then we will hopefully have those available for feedback at the August GTAC meeting. So we will continue, as evidence grows, we will continue to add information. So, for example, child passenger safety was not one of the ones that was initially picked. There's lots of information on child passenger safety that will be forthcoming. Same as bike and pedestrian injury, other injuries as well. So, committee members, do you guys have anything to add to that? Any questions about that? Suggestions for once we get past our first initial round, what other topics you would like to see the committee? A quiet group. Okay, so that's where we are on that. Sixth thing on the agenda is Mary Ann had the opportunity to attend the new American Trauma Society's Injury Prevention Coordinator course. She provided feedback to the Injury Prevention Committee at the workday meeting, but I've asked her to provide feedback for the rest of it.
So have any of y'all heard about this course? There's been one so far. It is an injury prevention coordinator course, and it's predominantly for people that work in injury prevention field, hospital-based. Some of them weren't hospital-based, but it was developed by the Society of Trauma Nurses, American College of Surgeons, the East, TCAA, the AAST. So it's got some good backing. It was a 2-day course. Paulette Golden from THR Fort Worth we went together. It was 2 whole, like, long days. I mean, like 8 to 5. And it was fantastic. I was surprised, not surprised, but I mean, I was a little leery because I've been doing this a little while and I'm thinking, okay, but really they did a fantastic job in gathering the information. It's been a long time in coming. It dealt with trauma systems, how to develop strategies to and plans to advance injury prevention, mechanisms of injury, financial options and considerations, developing a business plan. It included logic model. It included the spectrum of prevention. It included the Haddon matrix. So anybody that's been in injury prevention knows that we love all those things. It talked about public and population health, which working in a hospital, we don't think a whole lot sometimes about population health, but that was very informative. It talked about data sources, how important data is. It talked about epidemiology, how to, the tools that you need to define that data and what programs are needed. There was a big section even on research and the role of injury prevention in research, and talked about the role of injury prevention in advocacy and media options, and actually even working with your PR department. So, I mean, it was very meaty. I left thinking, I gotta go back and read the book again, because it was an excellent course, and I am personally happy to endorse it. I think Paulette had the same views. It was a very good course. Of course, when we went, it was the inaugural course, so we all had a ton of evaluation and feedback to give them. One thing was to make the slides bigger, because a lot of us can't see them. But it was a very, very good course. I would recommend it. Again, it is called the American Trauma Society Injury Prevention Coordinator course. The only drawback I saw in this whole course was the cost. It was very expensive. It was like $460-something for 2 days. I will.
Was that just the course period? So that didn't include travel?
Yes, that did not include travel. Right, exactly, Paulette. And it was a good course. So I'm sorry, Paulette. Do you have any other comments? No. Okay. All right. I learned a lot, so I would recommend it.
And we've also had this discussion at our committee meeting in Houston. I've had an opportunity to talk with one of the developers of the curriculum. I know they sought input from different groups. One of the nurses that led the development of the course is shared with us that they are soliciting feedback. I think they're doing the course again in September in Charlotte. It will be offered every year. I don't know that they will have plans to do it like for example, the Johns Hopkins Principles and Practices of Injury Prevention courses is offered every year in June at Hopkins. I don't know that ATS is going to that kind of detail. They plan to offer it every year, but they will probably move it around. The other thing that they said that they hoped to do in the future is they hope that this course will be a precursor to a certification, an injury prevention coordinator certification that ATS plans to do. So if you set for the course, you will, or you set for the test, you take the course, the test and certification will be less expensive than if you've taken the course.
Have y'all gotten that email yet? I got the
You
email
got the
last,
email?
I got
Okay.
the email, sorry, I forgot about it till just now. I got the email this past week talking about the development of a certification for injury prevention coordinators, so, which is phenomenal. I mean, it just raises us right up. Go ahead, Colin.
Could you forward that to
Yes,
me, please?
I will.
Thank you. Good.
I will.
Any other questions about the ATS course? Or one of the things that we tried to take on as a committee too is to provide as much information as possible about continuing education opportunities for injury and violence prevention and trauma. Which, by the way, did you mention the TTAP course already? Okay, I must have missed that. Okay. Any questions about the ATS course? Okay. Next on the agenda is National and State Injury Prevention Conferences. And actually, Stuart, if you wouldn't mind just talking about any updates regarding the Trauma Coalition and if there have been any updates.
Yeah, so,
Sorry.
wow, caught off guard here. AAST's Coalition on Trauma, I believe they're meeting in Las Vegas in September, yes. And as one of their pre-conference sessions is basically to have a injury prevention meeting summit for the first half of that day. And so they're inviting injury prevention coordinators and trauma managers, et cetera, across the state to attend that. Most of them will be attending for the clinical side of that conference, the gathering of the AAST group. So they think they've sent out a call for abstracts for 3 different areas. I think it's elderly adult falls, distracted driving, and alcohol.
And when does the
Yeah,
abstract
alcohol.
submission close? Do you know, Courtney or
I don't
Stuart?
have that date.
No, I don't know.
Okay. And that's Las Vegas in September, correct?
Yes,
Okay.
that's really all
Okay.
I have on that.
Okay. Any other questions about any national activities, initiatives that are going on?
Other, Safe Kids Worldwide will be having their national conference July 31st to August 2nd, I believe, in DC. So you can look up that information. I don't believe they have the full agenda out yet, but that information will be posted, I believe, shortly.
And speaking of conferences, one of the other things that we talked about at our workday meeting in Houston was the idea of actually planning another statewide Texas Injury and Violence Prevention Conference. And we threw out some ideas for locations, we threw out ideas for dates. Committee members, help me out here. I know we talked about 2016.
Hawaii.
Well, I don't think Hawaii was mentioned, but we did talk about resorts in Texas. So,
I don't think it'll be this fiscal year, though.
no, right. Right. We
17.
Oh, we talked about 17, okay. So that's in the works. Again, I think the committee is just continuing to explore options. We talked about Austin, we talked about Houston, we talked about Galveston, we talked about Corpus Christi. So, you know, what we'd like to do is, and we've talked about trying to plan in conjunction with other things that are already going on in Texas at the same time. So just stay tuned for that. If you have feedback, if you would like to have input, please contact either me, anybody on the committee. It will be discussed again at our July workday meeting as we move forward and try and actually nail down a year and then dates and things like that. But if there are things that you would like to see included in a conference, including, you know, the location, the length of the conference, the content, anything like that, we certainly want to hear from the stakeholders. So, committee members, do you have anything to add to that? Okay, well, we're moving right along. We got started late and we're going to finish early. Future meetings, we did schedule a workday meeting for, is it?
July 31st.
July 31st. It will be here in Austin from 9 until noon. I believe, Stuart, you're going to try and get us a room at Dale?
That's correct. I'm going to try to get your room.
Y'all need
Yes,
to
I
come to the
will.
meeting.
I will.
We actually get a lot accomplished we work pretty hard for 3 hours, but we do get a lot of accomplished. Any general comments from the audience? Stuart, do you want to introduce, and Susan, your new folks?
Yeah, I'd like to introduce our brand new injury prevention coordinator, Carly McConnell. Carly, if you want to raise your hand or stand up. She's new on our team. Today is her actual third day with our organization. So welcome, make yourself known to her if you would. She'll be serving as our new Safe Kids coordinator for Safe Kids Austin.
Chrissy Richardson is here. Chrissy is clinical educator RN with the trauma program at the Baylor Scott and White Temple, and she will be serving as the supervisor for the injury prevention program among many other tasks.
Okay. Chris?
General comments?
You bet. You're up.
I just wanted to make an announcement to make the Injury Prevention Committee aware that Injury Epidemiology Surveillance Branch has a new data set available. And that data set is the linked data set between crash records, EMS records, and hospital records submitted to the registry. And so we've successfully linked 2013 records, and for hospitalizations, we successfully linked 2010 through 2013. And so we're in the process of linking the entire continuum of care, and our next initiative is to link the rehab data that we have. So keep that in mind if there's anything that this committee is looking for data, for reports in the future, that we do now have this new capability.
That's great, Chris. Great news. Could you do just maybe a brief presentation on what's available at maybe the August GTAC meeting?
Correct, we can do that.
Okay.
That would also probably be a good topic at the July work group meeting
Mhm.
to see if
Okay.
we want to, you know, while we're working on our component
Mhm.
things, to look for some specific reports that maybe we can use this data set for.
Okay, I will send you a meeting request. Could you also come to the July meeting? It'll be here in
It'll
Austin.
be here.
We'll be able to attend.
Okay, I'll send you a meeting request for that. That will be July 31st, and I'll put you on the agenda for the August GTAC meeting as well.
Thank you.
Thank you. Anybody have any questions for Dr. Drucker? Okay. Any other public comment? Okay, well, if not, as I said, our next workday meeting will be July 31st here in Austin. We'll have agendas available for that. The committee will be working on the evidence-informed strategy documents, and we will make those available for the August meeting. We'll hear from Chris and his team at the July meeting as well as the August meeting. And if you haven't already done so and are interested, please register for the TTAF TIPS course, which will be August the 17th. It'll be the Monday prior to the regular GTAC meetings. So otherwise, meeting adjourned. Thanks.